To uplift and empower the disadvantaged and underserved communities in combating chronic diseases. That's the mission of ABCs for Global Health. Its advocacy and dedication have already led to the adoption of 18 different communities in the Philippines. And 3 of these communities are of the indigenous community of Aeta people. The Aetas are a group of indigenous people in the Philippines. They are among the 17 million indigenous people in the country. Nature is their ally, as their primary source of income is farming. But although seemingly living a simplistic and nature-friendly life, the community is surrounded by serious chronic diseases such as malnutrition, intestinal parasitism, and oral health problems. These are the inevitable impacts of the scarcity of resources and inaccessible necessities such as clean water, healthy diet, sustainable livelihood, and many more. One of the communities experiencing these risks is the remote community of Barangay Diaz in Porac, Pampanga.
Alaking kabiyayang kini uling alaking tamnanan. Ala kami kay lugar ni. Mendam kami muking kay lugar ni para ting kami toknangan. Ngini ing lugar mi king bundok karing kami pwedeng mananaman. Ning malaut nung lumakad ka tinga 2 oras. Lakaran mi.
The lack of access to these vital needs is what leads to health complications, including the development of chronic diseases. And in this particular community, malnutrition has a high prevalence.
Minsan uling sana kami karatang pamangan miking bundok. Balam tang mix mi tang oras mi. Pero akay tang manyaman kami oras-oras, manyaman kayo kakanan ali. Kaya po kenda nung anyapin daw dyan nga 2 pesos sinup niya para ating kang inuman na malinis. Kasi, nung kasi minum kami kaya nagyanda nung yan, marinat niya pilaretang pangkalusugan. Magkasakit na kami.
Furthermore, the healthcare of the residents is ultimately challenged due to the lack of health literacy that stems from poor education and inaccessible health facilities.
Uling nung keng kapong ospital, nung din nakareseta, ala ka rin pera. Siyempre, paalog mo na, miyayar mo ng anak mo. Nung munukar niya dapat maremedyo. Ala.
Bakit?
Ala kang kay. Nung yan nilugo, nung ating kang gitak. Lakaran meron makabandala, magbabaka. Ala na masakin.
With this, the ABCs for Global Health aims to be of aid to the community through the provision of food supplies, sustainable livelihood, clean water supply, as well as its health services.
So for this community, the Aeta communities, the problem is already multifactorial. So it's not just a straightforward problem where you just address malnutrition with just feeding the patients, the children. So everything boils down to it being a multifactorial problem. Like without a sustainable livelihood, families cannot afford nutritious meals. Without nutritious meals, children and their families will remain malnourished. And then there's also the problem in sanitation, because without a clean water supply, people won't have access to hygiene, good sanitation. So everything boils down to it addressing in multiple strategies. So for food, right now, there you could think of short-term solutions, like since now most of the children here are malnourished, so you start with a feeding program, and to make it sustainable, you should involve the community. So you can ask the parents to cook meals that they could repeat when even with ABCs not being around. And then after that, you start planting community gardens, which these communities have, but it's so small that it could not sustain the whole community. So we have to think of ways to expand that. Then with these gardens, community gardens, they could, if we have further expanded it, this could be a source of livelihood. The next problem is sanitation and hygiene. So to address all these, ABCs cannot do it alone. So we need collaborators, we need partners to address these problems. Luckily, we have the Department of Education providing the feeding programs for the children while they are in school. Then the Department of Health, the partnership of the municipal health officers, them addressing the intestinal parasitism prevalent in the communities. So that this is also another factor in resulting to malnutrition. And then the government also has its role in providing access, road access, and then providing water supply. So if we could collaborate and meet and discuss all of this, then these problems can be addressed.
The community of Barangay Diaz is an example of how many indigenous communities in the Philippines are not able to achieve and acquire their basic needs. Although there are efforts, there is still a lack of funding, facilities, and government-led programs. This hinders them from obtaining their needs. Unfortunately, Barangay Diaz is only one of the many indigenous communities in the country that suffer from these same problems and risks. That's why the ABCs for Global Health welcomes any assistance from you to alleviate the situations of these communities. With that, may we all unite to bridge these communities to health, education, and sustainability. Because together, we can do so much more.